Gynecological cancers are often referred to as silent, with really subtle symptoms that we just heard about. It's important to know the risk factors, how to recognize possible symptoms, and then when to contact a healthcare provider. So right now, we're going to continue this conversation about gynecological cancers and ovarian cancer with Dr. Kelly Leggett with Cone Health Center for Women's Healthcare and Vice President of Acute Hospital Clinical Services for Cone Health. All right, let's just start kind of with the basics, because this is a scary topic, especially when you hear that it is the silent cancer. Let's start with explaining what these gynecologic cancers are and why awareness is so very important.
Yeah, there's actually a lot of complexity to gynecological cancers because there's 6 different aspects of your reproductive organs that could get cancer, starting with your vulva, your vagina, your cervix, your uterus, your fallopian tubes, and your ovaries. And each of those can have distinct cancers with distinct symptoms. So it's really important to understand your body and talk to your doctor about your symptoms so that they can help you delineate when you need to have testing done and when you need to come to the doctor. Dr. Google is not your friend. And so it's really important to have a gynecologist that you trust that can actually do an exam and answer your questions, because it can be really confusing if you think about all the different aspects that could go wrong and have a problem. You want to be able to have someone you could do a thorough exam and order the correct diagnostic tests. Approximately 108,000 women will be diagnosed with a gynecological cancer this year in 2024, and about 32,000 will die. So there's definitely a lot of opportunity for increased screening and treatment early. So that's why it's important to go to your doctor.
Okay, yeah, go to your doctor every single year, and go to your doctor when you start feeling something that's just not right. I mean, you know your body, so if something's not right. Let's talk about the role that family history has when it comes to these kinds of cancer risks.
Yeah, we're learning more and more each year. When I first became a doctor, there was almost no hereditary risk factors. But ovarian cancer is associated with something called the BRCA gene. It's associated with breast cancer and ovarian cancer, but also surprisingly, it's also associated with pancreatic and prostate cancer. So when you think about your family history for a female cancer, you got to also know your male relative's cancer. So if you had a relative with male breast cancer, yes, they can get breast cancer. Or they had aggressive prostate or pancreatic cancer, that all goes into part of your genetic history, which would determine if you qualify for a genetic test. Uterine cancer or endometrial cancer associated with Lynch syndrome, which also has a high association with colon cancer. That's another thing you need to know about your family history. Cervical cancer also has a family, a genetic component, but we haven't isolated the gene yet. But we do know that cervical cancer can run in families.
Okay, so that's good to know. I mean, it's one thing, sometimes some families don't talk about things, but you got to talk about things so that you can be able to then protect yourself and protect your family members that are coming after you as well. What other risk factors should people be aware of that could increase their risk of, let's say, an ovarian cancer?
Yeah, so we kind of need to, if you want to go through them step by step, ovarian cancer is associated with not having children, starting your period early and ending menopause late. It can also be associated with infertility and also infertility drugs or infertility in general. So if you have some of those problems, then you also make sure your doctor knows all of that, and then keep that in mind when you start having symptoms that could also be if you have these risk factors. Fortunately, there are things that protect you from ovarian cancer, and that's use of oral contraceptives, having a tubal ligation and having the ends of your fallopian tubes removed. So now we know a lot of ovarian cancer starts in the edges of the fallopian tubes. So if you have a sterilization, make sure your doctor removes all of the ends of your fallopian tubes. Having pregnancies and breastfeeding can reduce your risk of breast cancer as well. Gotcha. I'm sorry, ovarian cancer.
Okay, this is one of the most important things, and that is the subtle symptoms to watch for, especially with ovarian cancer. What types of symptoms are we talking about?
So one of the biggest symptoms is getting full early satiety and then also bloating. And what makes it so confusing is that that's a lot of symptoms of irritable bowel syndrome and constipation. And a lot of people write off these symptoms like, oh, it's just, it's my gut, it's my bowels. And unfortunately, doctors do too sometimes. So if you're having any bloating, getting full early, pelvic pain, a change in your stool color, like all of a sudden becoming constipated and you never have been, those are the things you need to go to your doctor about and ask those questions.
Okay, and so something that we were just talking about in the break is that a lot of times women go to the doctor and they think that one certain test is going to show everything that they need to know.
Yeah, so a lot of people think that just if you have a pelvic exam or a speculum exam, that you're getting a pap smear. And the pap smear is only a test for cervical cancer. So it does not test for anything else other than cervical cancer, not endometrial cancer, ovarian cancer, vulvar cancer. So usually this test is done at your gynecologist office or your primary care office, and you would be discussing it's a screening test. We do speculum exams for a lot of other reasons, but we only do the pap test every 3 to 5 years, and I'm usually done in an annual checkup exam. So, and it's never done in the emergency room. So don't think you've got a pap smear if you've gone to the emergency department.
Gotcha. Okay. So the myth was that pap smear was covering you for ovarian cancer. That is not the case. So that means even more you have to be a heightened state of awareness if you're experiencing those subtle symptoms. What should women do? When should they contact a healthcare provider if they're feeling these things?
So never wait for your annual visit. A lot of women's like, well, I don't want to bother them. I'll just wait. It's in a few months. So please make a separate visit with your doctor so they can spend the time needed. But if it happens several days, most days of the month, if it's severe, please make the appointment. But in general, we're there for you. And if you have a question, either send us a MyChart message, or you can to your provider, or make an appointment and take that time and prioritize your health.
Okay, we've got a little bit less than a minute to go. Are there any lifestyle changes that we can make to help reduce our risk?
Smoking can increase your risk of cervical cancer and one type of ovarian cancer. Maintaining a healthy weight can also decrease your risk of endometrial cancer. Obesity has been shown to have your fat cells produce a lot of estrogen, which then can increase your risk of endometrial cancer. Exercise has been shown to decrease the risk of endometrial cancer as well.
Okay, gotcha. A few risk factors there that we can all take charge of. If you missed any of this information, you can find it in our website in the To Your Wellbeing section.